Hello there, my name is Yu Chu. I am a PM&R resident in New York. I have been asked a lot of things about what PM&R is, and I figured the best way to explain it is through a simple presentation. And now I was hoping to educate the masses on what exactly PM&R is, what they do, and a little bit of background behind it. So the first slide here is, what is PM&R? Well, PM&R is essentially physical medicine and rehabilitation. Other names for it are physiatry or physiatrist, or you can also call us rehabilitation medicine or rehab docs. PM&R is one of the 24 medical specialties certified by the American Board of Medical Specialties. It emphasizes prevention, diagnosis, and treatment of disorders. Specifically, we deal with disorders of the nerves, muscles, and bones. PM&R is essentially an integrated care in the treatment of conditions related to the brain, muscles, bones, spanning from traumatic brain injuries to lower back pain. A little bit of history on PM&R. The field of physical medicine and rehabilitation began around the 1930s. The pioneers in PM&R addressed the musculoskeletal and neurological disorders. This scope was much more broadened after World War II, when thousands of veterans came back home to the United States with serious disabilities. With this came an immediate need to help rehabilitate these disabled veterans to a more functional and productive life. The American Board of Medical Specialties granted PM&R approval as a specialty in medicine in 1947. So, what is a PM&R physician? A PM&R physician must have completed medical school training in either a DO or an MD field. They then must complete 4 years of postdoctoral training in an ACGME accredited PM&R program. This usually includes 1 year of preliminary internship and 3 years of residency. PM&R physicians are experts who treat injuries or illnesses relating to the nerves, muscles, and bones. The goal of PM&R physicians is to decrease the pain and enhance performance without surgery to the best of their ability. PM&R physicians are also known as the quality of life profession, with focus on enhancing patient performance. Training for PM&R. Currently, there are about 80 accredited residency programs in PM&R in the US. It is slowly growing, so these numbers will probably change by the time you read this. Many complete fellowship training after the 4 years of required training for becoming a PM&R resident, PM&R physician. These fellowships include musculoskeletal rehabilitation, pediatrics, PM&R, traumatic brain injury, spinal cord injury, sports medicine, and many other fields. For board certification in PM&R, physicians are required to take both the written and the oral examinations administered by the American Board of Physical Medicine and Rehabilitation. So what are the roles of PM&R physicians? Well, they diagnose and treat medical conditions associated with disabilities. These include cognitive problems, orthopedic disorders, mobility concerns, bowel and bladder issues, gait disorders, feeding and swallowing problems, communication difficulties, as well as pain, muscle stiffness, and hypotonia. PM&R physicians work collaboratively with multiple other professions, mainly being neurologists, orthopedic surgeons, neurosurgeons, physical and occupational therapists, speech therapists, as well as primary care physicians. PM&R physicians assess and improve function of the patient. They address caregiving, mobility, activities of daily life, of daily living, For example, dressing, bathing, eating, educational, vocational, and lifespan issues. PM&R physicians are able to prescribe medications for disorders including muscle and nerve disorders, attention and memory issues, behavior and sleep disorders, pain disorders, bowel and bladder concerns, respiratory issues, gastrointestinal issues, as well as many other problems. Common disorders treated by PM&R physicians, they include carpal tunnel, neck pain, back pain, sports injury, industrial or work-related injuries, herniated discs such as slip discs, pinched nerves such as sciatica, arthritis, stroke, brain injury, concussion, and many other disorders. PM&R physicians can further prescribe things such as braces, splints for the arms and legs, prosthetics for loss of limb, wheelchairs, standers, walkers, bath benches, lifts, and other medical equipment to improve mobility and safety of the individual. PM&R physicians can also advise school and vocational programming for disabled patients. Behavioral and cognitive and learning issues are also another field that PM&R physicians can take part in. PM&R physicians focus on the development of a comprehensive program for helping the patient improve medically, socially, emotionally, vocationally, and physically. To learn more about PM&R, please visit the website aapmnr.org. You can also look at the U.S. News ranking in best rehabilitation hospitals in the U.S. You can also look at the NYU Rusk Rehab Langone Medical Center. And to further locate a PM&R physician in your area, please click on the link below. Thank you very much for your time.